Hey guys, good morning. Annie here in Tucson, and I wanted to post a quick update. Um, I think how I'm going to kind of section this video is give like a health update about where I'm at with the oncology side of things. And then at the end of it, I'll be going over what my chemo symptoms have been over the course of the past 3 months. So if you're experiencing kind of this cancer journey right now, and you want to know what my experience has been with the side effects of treatment, that'll be at the tail end of the video, just to give you an idea of what to expect from my opinion. So a week ago on Halloween, I woke up and it was about 2.5 weeks out from my last chemo treatment. And that's usually when I start feeling better. I have a solid like 4 or 5 days where I can taste food and I feel like I have enough energy to just do chores. I feel like I kind of am re-entering the living. So I woke up Halloween Day, which was Tuesday of last week, and had some eggs and toast and could taste it and was so happy. I had half a cup of coffee, which I have not had coffee at all. Um, and everything tasted so good and I was so excited to be Uncle Fester. That was going to be my costume. And then about an hour after eating, I was bathroom bound. Could not even leave like the circle of my room. Which diarrhea is a byproduct of the TCHP chemo treatment I'm on, but usually not that late in my schedule. So I was down for the count. My sister stepped in to help with the kids. I could not leave my bedroom. My husband ended up doing all of Halloween. He took care of everything. And then around 10 o'clock, I had consumed at least 60 ounces of water. I had done really well considering, how I was feeling. But around 10 o'clock, I spiked a fever. And if you, as a cancer patient, spike a fever of over 100.4, it's an immediate ER visit. So I got to 101.6. I really didn't want to go. But my husband insisted, obviously. So we went to the ER that's closest to our house. And while I was being moved from a seat in the waiting room to a wheelchair, I passed out. And my husband caught me. It was very heroic. It was really knight in shining armor moment. I'm sure his back still hurts. Sorry, honey. So he caught me and they wheeled me back and took action. I guess I was out for a few minutes maybe. So they insisted on having me stay there until I could be admitted to Banner Oncology. I went to Banner Oncology. Ultimately, what it ended up being was a virus. My kids ended up getting a very minor version of it a couple of days later. But the biggest concern was my heart enzymes were high, which is a symptom of heart failure. And then they had a positive bacterial infection blood culture, but then they ended up determining that that was an infected IV or a contaminated IV. I hope I'm saying all that right. So I was in the hospital for 3 nights, 1 night in the ER, 2 nights in the hospital. Took my vitals, everything looked pretty good. My blood pressure has been pretty high over the course of treatment. So that's kind of what happened then. What is going on now? I was discharged from the ER Friday of last week and then set to have treatment again on November 8th, which I did. So I went in, had my lab work done. My oncologist is concerned because I have low hemoglobin and low platelet count. So she did reduce the dosage of the TCHP treatment, but we continued with it because she didn't want me to miss a week. So I did have it done. I'm going in today. Today they're going to do labs again. They're going to give me more fluids. And if my numbers are still low, I will do a blood transfusion today, which I've never had done before. But, if it makes me feel better, I'm all for it. She also ordered a cardiologist appointment stat. So that's going to be happening next week. I'm also going to be having my MRI next week. So the 20th is a Monday, and I go in for MRI of my left side. This is to show how successful the chemo has been. It's also going to show about, it'll show the lymph nodes as well as the breast, and kind of see what we're looking at as far as shrinkage goes. Shrinkage, the only time the word is good. So that's going to happen on Monday. Then I will be going to the cardiologist on Wednesday, to make sure my heart is looking good. That's one of the biggest fears of this TCHP treatment, is that your heart can, heart toxicity can develop. And that is her biggest concern because of my numbers and because of my heart enzymes. So that's where I'm at after the cardiologist. If everything looks good with the cardiologist, I might get on beta blockers or something to kind of manage my heart rate and those numbers. I will have another appointment on the 29th. It's a very busy month. I'll have another appointment on the 29th with my oncologist to determine if we are ready and good to move forward with my surgery. That surgery will be scheduled for December 19th. I have on the 20th of November and on December 4th, I have my plastic surgery pre-op, and then I have my oncological surgery pre-op, as long as everything looks good. God, my voice. I'm tired of hearing my voice. So that's what's going on. I guess my biggest ask is for prayers, thoughts, love, hope, good energy, light, love, laughter, joy toward my MRI. I really, from the exterior, she's saying that everything feels as though the borders are less clear. It feels, less pronounced, smaller, but we won't really know until we get in there. So that's Monday of next week. So my fingers are crossed that everything is going to go in the direction of surgery December 19th. As far as if you were just wondering about my health update, that's all I'm going to say about that. Now I'm going to kind of go into what my consistent symptoms have been as a result of the TCHP chemotherapy. If you haven't been following my story, I started treatment August 10th. It all happened within a week. I was diagnosed and then started, I was diagnosed with breast cancer, invasive ductal carcinoma. Stage 3, we think. She still hasn't staged it. I don't understand. But that happened all the beginning of August. On August 10th, I started AC treatment, which is known as the Red Devil chemotherapy. After my first round of AC treatment, we discovered that I was HER2 positive as well. So I'm triple positive. So I'm being treated for triple positive, which is hormone responsive, and then this HER2 protein positive as well. So there's a couple different ways that we come at it for treatment. So I did 2 rounds of AC treatment. Then they started me on TCHP, which is 2 of those initials are for a chemo treatment, and the other 2 are for an antibody treatment. The antibody treatment, I'm going to continue on for at least another year. The TC part of it, I'm hoping I'm done. Hoping I'm done, depending on what the MRI says. What to expect with TCHP. So you go in. This is what my port looks like. Sorry if that's gross to you, but this is the real life cancer. So this is basically a spot where they've placed a port and they puncture it when you go in there to get your blood work done. I do put lidocaine cream on it. It kind of comes up, goes up and over, and then goes down to my heart. So what they do is they take blood from there when you first go in. It's about 30 to 40 minutes wait time for your labs to come back. After they make sure your numbers are okay, you go in and then you get pre-meds. So my pre-meds are Benadryl, a lot of Benadryl. It usually knocks me out for about 20 minutes. There's like an antacid, and then there's a ton of steroids. Dexamethasone is the one that I believe I'm treated with there, and then I also have it as a prescription after the fact for 3 days. So it's usually about a 6-hour time that you're there at the cancer center. Some of them, they do the drip and then they have to wait to make sure you don't have a reaction. And then it kind of depends on what your nurses do for you there. But it's about 6 hours. I don't really experience terrible symptoms until about day 4, because the steroids really take action right away. I'm usually starving. This is why I look like this. I'm usually starving for the first 2 or 3 days where I just eat everything in sight. It's like Cookie Monster, like I can't stop. Um, and the lethargy usually hits around day 3 is when I could just sleep all night long and not move a muscle. After those initial 3 days, that's kind of when I am dead to the world a bit, where I kind of am observing life from the outside, kind of looking in, but not really present. Super tired. That's when my tongue pain usually starts, and my hands, they're not that bad this round because I had a smaller dose. Um, and then also I get this rash every time under my arm. So the mouth thing is kind of hard to explain it. Some people call it dry mouth, but I feel more like it is like my tongue was scraped with sandpaper and it's slowly starting to heal. And I know that sounds terrible. It's terrible. It's really bad. And I can't taste anything. So that usually starts around day 4. That's also when the bone pain starts. So there's I want to say it's Nuoplasta, but I know that's not the name of it. There's a pump that they put and they inject it onto my tummy when I get my chemo done. It goes off 27 hours after I have treatment. And that is to build up the white blood cell count supply to help with your immunity. It causes pretty severe bone pain and it causes me nausea as well. So that usually hits, day 3, day 4 is when that's really in your system. So can't taste, body sore, nauseous. I do take Zofran. Zofran is the dissolvable anti-nausea pill that you're given, which does help. But around day 5 is when I can't taste anything. Everything tastes really, really weird. The bone pain hits. This round, there's been a lot of, my nose has been really bloody. Getting bloody noses. And then usually around day 6 or 7, which is what I'm at right now, that's when the eye watering starts. Because your mucous membrane, everything is being like frizzled. Frizzled? We've been watching Magic School Bus. That might be fried. Your mucous membrane's getting fried. Also, your brain is getting fried. So you have chemo brain too. So you sound like this. So eye watering usually starts right about now. I just woke up and that's kind of what's going on now. I don't have taste for about 6 to 7 days. And then slowly but surely things kind of start looking up, like where I feel like I'm actually going to be returning to a member of my family and not just somebody who's listening from the back room. It's not good. It's not good. The neuropathy, the pain in my feet has not been too significant this round. Like I said, it has been a smaller dose. But what people may or may not know is that it's cumulative. So my hands have never really healed from the first time I had this hand, foot, mouth symptom as a result of the chemo. They've always been red ever since then. The rash under my arms kind of goes away, but it's kind of like dry, patchy skin there now. I've lost all of my hair except these little eyebrows and a little bit of this. I mean, I am bald as the day I was born. Probably more bald because I don't think I was bald when I was born. So that started happening right after, probably 12 days after my first AC treatment. So, what do I suggest? I can only really taste vanilla yogurt, applesauce, and my husband last night made me a baked potato. So really bland foods that you're not going to be pissed off if you taste them and they don't taste right. Like what I really want is like an In-N-Out cheeseburger and like freaking overdone fries and a Diet Coke. That's what I really want. But I will be so pissed off if I get it because I can't taste anything. So have mild, bland foods that you're not going to be mad if you can't taste. I'm not going to be sad if I can't taste a cup of applesauce. It's a cup of applesauce, I think that's all I have to say. about the side effects. I guess if you have any questions, post them below and I'll tackle them. But holy crap, that's 15 minutes of me talking. So I'm going to end this now. I appreciate all of you so much. And I will keep you posted about what the results are of the MRI next week. Bye.